The liver is the body's main filtration system, like a complex chemical processing plant that runs 24 hours a day. It cleans over 1.4 liters of blood per minute, screening toxins and bacteria. The liver also manufactures essential nutrients, proteins, enzymes, and hormones that regulate thousands of functions, all while metabolizing fats, carbs, proteins, managing cholesterol levels, storing iron, and facilitating blood clotting. This tireless powerhouse worker is easy to take for granted until something goes wrong. In alcoholic liver disease, alcohol becomes the merciless saboteur, inflicting increasing damage over months and years of excessive drinking. Alcohol produces free radicals and toxic byproducts inside liver cells, setting off a dangerous inflammatory cascade. Unchecked stress cascade forces fat to balloon inside cells, obstructs vital oxygen and nutrients, and leaves a trail of cell carcasses in its wake. In the early stages, alcohol breakdown generates acetaldehyde, formaldehyde, and reactive oxygen species, highly toxic compounds that attack the delicate cell membrane walls and DNA infrastructure inside. As toxin damage accumulates, overworked liver cells struggle to process fats. Globules of fat droplets begin accumulating in the cytoplasm, a condition called hepatic steatosis. The bloated fat-engorged cells start crowding out healthy neighbors, disrupting flow through liver tissues. Blood chemistry chaos ensues. Meanwhile, dying fat balloon cells trigger even more damaging inflammation through the liver structure as immune cells rush onto the scene. Surviving overtaxed liver cells desperately try to compensate but start losing their specialized functionality. Within months to a few years, sustained free radical chaos, fat clogging, and inflammation destroys healthy operating capacity. Without intervention, the sustained siege of alcoholic hepatitis causes fibrosis, extensive scarring as fibrous proteins harden throughout liver tissues. Eventually, cirrhosis sets in, the late-stage consequence of sustained alcohol assault on liver cells. In the early phase of alcoholic fatty liver, subtle symptoms like fatigue, nausea, weight loss, and loss of appetite may be the only whispers announcing liver distress. But left to its own devices, an inflamed liver doubles in size, straining against the ribs. As fibrotic scarring sets in, the entire liver takes on a lumpy, shriveled texture compared to its former smooth, soft form. Often the first noticeable symptoms arise as cirrhotic changes make blood flow turbulent and hormones fluctuate. Fluid retention leads to bloating and edema as high blood pressure strains vessels in the liver itself. Patients may notice an enlarging abdomen or distended neck veins. The inflamed liver becomes inefficient at making albumin and clotting factors, causing funky bruising. Upset stomach, nausea, and diarrhea after meals become common as circulation and bile production falter. The body telegraphs accelerating problems through jaundice, easy bleeding and bruising, reddened palms, and spiders on skin signaling new dilated capillaries. Mental confusion, sleep inversion, and mood changes point to hepatic encephalopathy as toxins build up. Fluid in the abdomen signals undue leakage from congested vessels and lymphatic obstruction. These are all dangerous signs that liver function is headed off the rails. With over 500 vital roles, declining liver function causes system-wide unraveling. Hormonal disruptions lead to gynecomastia and testicular atrophy in men, absent periods in women. Toxins accumulate, causing memory issues, tremor, blurred vision as coordination suffers. The liver manufactures cholesterol, bile salts, albumin, and blood thinners, all essentials now in short supply, putting the body at high risk of cascading failure. Quitting alcohol immediately is an urgent first step to stabilizing and potentially reversing some liver damage. Even then, supportive therapies focus on managing complications, controlling withdrawal, replacing nutrients, and preventing further harm. Outcomes vary based on disease stage and commitment to positive lifestyle changes. In severe alcohol hepatitis cases, transplant may offer a sliver of hope. Ultimately, longevity depends on early detection and patient resolve to nurture liver health for the long term. In conclusion, alcoholic liver disease sets off a violent chain reaction that causes whole body mayhem. But much of the harm is largely preventable through understanding alcohol's destructive effects. Catching disease early and promptly quitting alcohol are vital first steps to restoring order and enjoying greater well-being ahead. With compassionate support and patient perseverance, the liver has a remarkable capacity to bounce back.